Hello, my topic is single-dose Oritavancin in the treatment of acute bacterial skin infections. Definition: Oritavancin is an antibiotic and semisynthetic glycopeptide drug that is used to treat serious gram-positive bacterial infections. The U.S. Food and Drug Administration and the European Medicines Agency have approved Oritavancin for treatment of acute bacterial skin and skin structure infections.
Because of our shared mindset, ICPD scientists often see opportunity where others do not. An example of this can be seen in the story behind Oritavancin, a drug that may not be on the market today if it wasn't for the science of PKPD. Eli Lilly discovered Oritavancin a quarter century ago, and like many long half-life drugs, they tried to develop it as a once-daily regimen. But for some reason, they couldn't get it through phase 3 trials. So in the early 2000s, Oritavancин's development was taken over by Intermune, and they too tried to develop it as a once-daily regimen. Not seeing Oritavancин's potential, they decided to refocus their company and sell it to Targanta. Targanta continued developing it as a once-daily regimen and invited us to work with them. However, after carefully evaluating the PK and PK/PD profiles of Oritavancin, our teams realized that the solution was not to administer it as a series of small daily doses, but rather as one big single dose. Targanta decided to shelve this idea now, but explore it later, after the once-a-day regimen got approved. So they submitted it to the FDA for approval, and after many months, the FDA came back with a rejection. Daily doses of Oritavancin weren't that effective. Seeing the potential in previous PK/PD data, Oritavancin was then acquired by the Medicines Company. With ICPD's support, they conducted further clinical studies to put this novel regimen to the test. With the data from these trials in hand, the Medicines Company submitted Oritavancin to the FDA as a single-dose regimen, and success. On August 19, 2014, the FDA approved Oritavancin as the first single-dose regimen antibiotic for complicated skin and skin structure infections. Reflect on that for a moment. The exact same drug was submitted twice to the FDA, yet it was the dosing regimen based on PK/PD science that made the difference between rejection and approval. This is what we mean when we say that PK/PD is essential to drug development. And in some cases, it is the difference that determines whether a valuable drug makes it to market and benefits patients. After all, isn't benefiting patients what drug development is all about?
Application in medicine. Oritavancin injection is like a powder to be mixed with liquid and given through a needle or catheter placed into a vein. It's usually injection slowly over a 3-hour period as a single dose by a doctor or nurse.
I got it. So at our institution, we developed a protocol for appropriate use of Oritavancin, and one of those implications in that protocol is using Oritavancin to expedite patients who are admitted inpatient to expedite their discharge. So in this study, we looked at patients who received Oritavancin to expedite their discharge, and we looked at patients who received conventional treatment with vancomycin and oral antibiotics. In terms of cost avoidance, even though we spend a significant amount of money for the medication, which is about $2,700, we save money in the long run because we are reimbursed based on DRG or diagnosis-related group. And for us to receive that, it doesn't matter how many days the patient stays in our hospital, we get the same flat rate. When the cost of a hospital admission is $2,750 a day for a patient to walk through our door and sit in the hospital, not including any labs or tests or drugs or nursing time, and we only get reimbursed about 5,400 of that. We want to try to match that as close as we can. In terms of clinical implications, by using Oritavancin, our patients have less time in the hospital because we're using it to get them out. A lot of times we keep patients inpatient to just give them IV antibiotics because we maybe don't think that they'll take oral antibiotics, or they're have too severe of an infection to take oral antibiotics. So we keep patients in the hospital longer just to give IV antibiotics. But the Oritavancin completely eliminates the need for patient compliance. We give them the once infusion, and the patient receives antibiotic treatment for the whole course as they would staying in the hospital with IV. Additionally, patients have less recurrence of infection, as we saw in the study.
Pros and cons. Pros: it is a drug with action against the majority of anaerobic gram-positive bacteria. It's effective at treating infections caused by beta-lactam antibiotics caused by bacteria. Cons: it can cause serious side effects such as vomiting, nausea, inflammation, tachycardia. It is a single-dose medicine that is given over several hours with the supervision of doctors or nurses. Use applied in Ecuador. They are not marked in Ecuador an exception for levofloxacin, and they have properties that, compared to the previous ones, present important advantage since they have a broad spectrum with marked activity against gram-positive and gram-negative agents, including anaerobes and gram-negative agents intercellular pathogens.
So one of the key findings that we found is that we were kind of surprised that we were actually doing a really good job with our skin and skin structure patients on the inpatient setting. Our length of stay was actually a little bit less than the national average, and our readmission rates are actually less than the national average as well. So at this meeting, we put together a poster to determine in that patient population, is Oritavancin therapy still advantageous? So would it still be okay for patients or for facilities that are really not experiencing a problem with patients with skin and skin structures staying too long, or maybe utilizing more resources than what would be expected, or maybe having higher readmission rates? And what we found is that we still saw a benefit. If you would actually admit those patients, that the facility was indeed losing money, and they were able to actually make money when we were to send them to the outpatient setting. And from an outcome perspective, we saw that readmission rates were actually much less, even though our readmission rates were already low. When we utilized Orbactive in the outpatient setting, the admission rates at that time were actually less. So we saw both clinical and financial benefit, even in that very non-critically ill population for skin and skin structure.
Conclusion: Oritavancin is a semi-synthetic single-dose antiviral that proves to be not inferior to vancomycin against acute bacterial infection of the skin and soft tissues with a similar safety profile. Its potential advantage compared to other therapeutic alternatives are in its administration in a single dose and without the need for monitoring of plasma levels, which facilitates its outpatient administration. Thank you.